All right. Good afternoon, everybody. It is 4 o'clock. Today's COVID update is going to be, come on in, going to be fairly short, though every time I say that, we run long. But we have a special session going on right now here in Frankfurt. So we'll do this and get back to it. First, let me say we continue to see more cases than is safe by any means. Saturday, Sunday, Monday, and Tuesday combined, 13,005 new cases, 60 new deaths. 8 of those deaths are Kentuckians under 50 years old. 119 red counties as of today. To break it down, Saturday, 4,732 new cases, 29 new deaths. Sunday, and this is when you start getting some of the underreporting that'll catch up, we believe, this week. 3,376 cases. That is a huge number for a Sunday. 17 new deaths. Monday, 2,541 new cases. That's with just about everybody being off of work. 9 new deaths. Tuesday, this will be like our normal Monday, which is one of the lower days. 2,356 cases, 5 new deaths. Now, as I look at those numbers, I think we ought to expect for folks to catch up this week and for us to have some really high numbers of cases, and I'm concerned a high number of deaths as well. Let's look at our stair-stepper chart. So some bad, but maybe bad news, but maybe a glimmer of hope. We have had our highest 2 weeks back-to-back. We just got finished with our highest week ever of COVID with over 30,000 cases, a number that most of us never thought we would reach. And again, it's tragic that we have that many cases at a time when they are preventable. Now, if you'll look, though, the Delta, the rate of increase between 2 weeks ago and last week is the smallest we have had in several weeks. Now, it's too early to say that that means that the increase is slowing down. It's too early to say there are signs that we may be approaching a peak because, as we'll show you in a minute, our positivity rate was going down. The last 4 days, it has gone back up. So we need to watch all of this very closely. So again, the bad news is we had the single largest week in terms of cases ever. That shouldn't be happening when there are vaccines and we know the power of masking. If there is a glimmer of hope, the rate of increase seems to be slowing. Let's look at the positivity rate as well. As you can see, week over week, even though we had some days last week of decline, still on the 7-day rolling average for the full week, it was the highest ever since at least we have enough tests to have an accurate rate. We will see where it goes this week. Let's show the rate of increase. As you can see there, a couple things could be happening here. We're doing so much more testing now, significantly more than the last 3-4 months of testing, that it may be catching up to give us a truer value. But again, with the last several days, it increasing, we don't know that our rate is slowing or not yet. Let's continue to look at the rate of COVID cases and vaccinations. This chart shows you how effective vaccines are, even against the Delta variant. Starting in March, and this was really the vaccine versus the Delta variant. You were 4 times more protected if you had taken the vaccine, which is in blue, and if you had not, which is, I think we determined that as a tan, a gray. Currently, August, you are 6 times more protected. So even though there are more breakthrough cases, because this is a very aggressive variant, your level of protection, if you are vaccinated compared to unvaccinated people, is better than it was even in March. So get your vaccine. With record number of cases, which lead to record number of hospitalizations, which we hope won't, but may lead to record number of deaths, being vaccinated protects you now more than ever. our hospitals continue to be pushed to the brink. Any day, we have roughly 2/3 of our hospitals in critical staffing shortages. As of today, it was 60. That's down a little bit from the 65 at the end of last week, but this can change very, very quickly. Our ICU beds available for adults are going anywhere from 115, 123, all the way down. We were under 100 one day last week, which we had never seen before. So again, if we have one bad week, we can very quickly run out. I will say the reason we are not out of ICU beds is the heroic work being done by our healthcare heroes and our hospitalization centers. We're going to hear from St. Clair in a minute, but just think about what they have done to expand the numbers of ICU beds. They have closed surgery rooms and centers and turned them in to ICUs. I believe there's been 3 separate expansions in St. Clair. Pikeville Medical Center has done this. So when we say there are 123 beds available today, that doesn't mean that we have less people in the ICU or many less people in the ICU. It means they have gone above and beyond to open up new beds to help people. As of today, 2,353 Kentuckians battling COVID in the hospital, 661 Kentuckians battling for their lives in the ICU because of COVID, and 435 Kentucky families praying for their loved ones that are breathing. 435 Kentucky families praying for their loved ones who are on a ventilator. At the end of last week, one piece of note is we repositioned one of our EMS strike teams. We moved it from Prestonsburg to Beaver Dam, and that's because of the amount of volume. That's what we want to be able to be, flexible in areas that need it the most. We also provided Baptist Health Hardin and Taylor Regional 4 additional ventilators each, though throughout the long weekend, we did not get additional requests. Remember, we're doing, depending on how hard a hospital has been hit, a number of different things to try to help them out. Number one, we're taking over their testing. We're sending in outside vendors that can set up at the hospital, divert people from the ER, free up clinicians, nurses, and others that would otherwise be doing that from the hospital staff. That lets them open up more beds. We've done that at Pikeville Medical Center. We've done that at St. Clair. I think we did that at Baptist Corbin. We did that at Ephraim McDowell. We're opening a new center in Pineville. Obviously, Bell County has been hit incredibly hard, one of the higher incident rates that we have seen. This will push people again away from hospitals to this site, knowing there needs to be more testing. So testing is one thing we've done to help free up staff. Second is we have sent National Guard teams in. They have been welcomed, and we are going to significantly expand the number of Guard teams that are out there. We'll have more news on that later in the week, but we will probably double at least the number of hospitals that they are assisting in. Third thing we've done is nursing students. We had Galen in here, and they are working so hard. I think they're in 7 at least different facilities around the state. They're now helping in primary care centers and others that are doing monoclonal infusions. They have really helped everywhere they've gone. We appreciate them and all the other schools. I believe Cumberland's, their nursing school, is helping in Baptist Corbin as well. Another thing that we have done, FEMA strike teams that we requested. We talked about the EMS strike teams, but we have also requested and now been granted and had a nurse strike team show up at St. Clair, which is a huge help. So as we know, St. Clair has been hit incredibly hard. We heard from 2 leaders from the hospital a couple weeks ago when they were overwhelmed, and the situation had only become more dire. Today, we're going to hear from St. Clair's president and CEO, Don Lloyd, Chief Nursing Officer, LaRae Wilson, Chief Medical Officer, Will Milon, and Associate Chief Nursing Officer, Courtney Hollingsworth, as they discuss the help they've received. Now, this help is helpful, but I want you to also watch them. They are tired. They are continuing to fight this war, and our prayers ought to go out to them for everything they're facing.
The assistance of an assignment of the Kentucky National Guard, the request by the governor for the HHS DMAT team, and the additional assistance from the nurses from the Galen University School of Nursing have been a godsend.
The DMAT team being here means that we've got a little bit of relief at this time. So I can't stress how important that is. They're providing relief to an already overtaxed staff they're just exhausted. And the DMAT team is able to take patients, and that allows our team to rest a little bit while still working. I mean, they're all still having to work, but they're not having to take quite as many patients at one time, which has been a great relief to them.
The arrival of the disaster medical assistance team has really been a godsend. We have been overwhelmed for a while. Their arrival has allowed us to kind of recoup, regroup, and get better care, and we completely are thankful to them and have great gratitude for their arrival.
It means so much just to have that additional help. We have been burning it at all ends. Our staff, all of our entire team has just been working so hard, and it's just a relief and a little bit of light to have this trained group of people to come in and to help us to relieve some of that pressure from us. We're very blessed.
On behalf of all of our employees and physicians who serve St. Clair Medical Center, I'd like to express my deepest appreciation to Governor Beshear and his entire staff for their support and assistance during this incredibly terrible surge.
So we wanted you to hear what it means when these overwhelmed hospitals get a little bit of help, but you can also see how tough and traumatic this is on each and every one of them. So to everybody at St. Clair or Corbin or Baptist Health Hardin, how they've been hit, Pikeville Medical Center, we are with you. We care about you. We love you. We want to help in every single way that we can. Know how appreciated you are through this very difficult time. So today we're going to hear another recovery story, which in and of itself is important. This is from Boyle County High School principal Mark Wade. As principal, Mark was doing everything possible to protect himself and others. He was masking up, and he had plans to get vaccinated when he contracted COVID in January 2021. After about a week with the virus, it turned into pneumonia, and Mark had to be admitted to the hospital. Listen, this story shows you how this virus doesn't discriminate. When he came down with the virus, Mark was only 41 years old, young, healthy, no pre-existing conditions. So it shows you how this can come for absolutely anybody. So please get vaccinated.
Hello, my name is Mark Wade, and I'm the principal at Boyle County High School in Danville, Kentucky. I knew that when COVID numbers began to increase with a career like mine, that you are constantly around people, I had to be careful. I knew that I was going to have to wear my mask and wash my hands often, socially distance, and ultimately get the vaccine when it became available. Unfortunately, I was hospitalized in January with COVID pneumonia. And when I first got COVID, I felt horrible. And after 6 or 7 days with the virus before it turned into pneumonia, I just felt horrible, just miserable. But I never thought I would be hospitalized. I was just 41 years old with no pre-existing conditions, pretty healthy. And when I became hospitalized, people they couldn't believe. He's too young, he's too healthy. The virus is no joke. It doesn't discriminate. When I was in the hospital and laying there and just receiving treatment with different medications, already on oxygen, and I remember looking at the nurse and saying, I need help. I cannot breathe. And I felt like I was just trying to breathe through a straw, and my chest was so tight. It felt like there was a lot of weight on it. And when I told the nurse I need help, I remember nurses and doctors rushing into the room with different respiratory equipment. And I looked at the screen, and my oxygen had dropped in the 70% for the oxygen saturation. And the nurse looks at me and says, "Mr. Wade, can we intubate you?" And it really, I was already scared. And when you receive a question like that, you think to yourself, I may never see my family again. But fortunately, the other treatments worked, and I spent the next 2 days on a BiPAP machine, which is a mask that covers your nose and your mouth and forces air. It really helps you breathe and opens your lungs back up. And that mask is really hard to sleep in. They tell you to roll over on your stomach and sleep when you have 3 different IVs in and on your stomach, it's tough. But you see, I'm one of the lucky ones. I had excellent treatment. I got there early. I didn't wait too long. There was space in the hospital, and the nurses and doctors were phenomenal at Ephraim McDowell and Danville. I spent the next couple of weeks after discharge on supplemental oxygen, and so I had complications due to a collapsed lung afterward, but now I feel like I fully recovered. But this experience has terrified my family and my children. The vaccine was not available before I was hospitalized or became ill with COVID, but it is now. And I trust that the vaccine will help me. I was vaccinated, and I did it for me and my family. I would never willingly put my family through this again. And so I do trust in the vaccine to provide protection. Do it for yourself. Do it for your family. Get the vaccine. It just makes sense. Thank you.
We want to thank Mark for sharing his story and even in the graphic detail that he did, knowing that if you're young and healthy, this thing can still knock you on your back, needing that amount of oxygen, being asked if you should be intubated and then taking, 6-7+ months to recover. Again, I think we kind of fall into this fallacy of, well, how many people die? And that's really important. But it's also how many people get incredibly sick, and whether it's a full recovery, but the trauma that you and your family have been through, the lost time, or whether it is how COVID can persist. Remember, this is something that even if it doesn't take your life, it can severely harm you. That's why we've got to do what it takes, get vaccinated, wear that mask. And somebody who's been through it in the hospital that many days, saying he would never, ever, ever want to go through that for him or his family, ought to be a clear message to those that haven't gotten vaccinated to get it done. So as of today, we have 2,567,645 Kentuckians vaccinated, 2,567,645. Over the weekend, that means it's 17,197 new vaccinations. I hope that is an undercounting because of the holiday weekend, because that's a little bit below what we've typically seen over a 3-day weekend, especially during the Delta variant. We do not want the rate of vaccines to slow, even though we're getting into harder and harder and harder to reach or convince populations. As always, we look over the information both demographically and geographically. So let's put up the ages. We're still at 69% of all adults in Kentucky. This means you can make your own decision on whether to get the COVID vaccine or not. This is with at least one shot. Still at 85% of Kentuckians 65 and up. I'd really like to see this increase. Again, this is a number that compares well with the rest of the country, but you are at such risk if you're 65 and up from COVID. This number needs to be 98, 99, or we would pray for 100%. 50 to 64, gone up a percentage, now at 72, 40 to 49, still at 59, 30 to 39, gone up 1 percentage point to 55%. Since we started really looking at this, the 30 to 39-year-olds have gotten better. More of them have gone in. We got a lot of people this age that are dying right now in the Delta variant, more so than ever before. 18 to 29, we just still need to do so much better. Not even half of people 18 to 29. Listen, when you're 18 to 29, you're out and about a lot. If you are vaccinated, you're less likely to be spreading it to other people around you. So even if it's not about you, please do it for your family, for your parents, for your grandparents, and for everybody else around you. 12 to 17, again, either this week or early next week, there ought to be a percentage next to this when we switch over to the new census numbers. Remember, these are going to change, right? Because the number of people identified most recently falling into these age groups will change from the last census. Geographically, let's start with areas 50% and up. We had 3 more join this list: Shelby, Hancock, and Marshall counties. Again, this is just 50%, meaning every other person that you run into, if you've just hit 50, is not going to be vaccinated. But it means that the numbers in these 3 counties are improving. Keep it up, keep pushing. We are now getting to a point where we will likely start showing a 60% and up as well, because to stop Delta, to finally end this thing, we need to be well above 60% in every county. Kentucky counties with less than 40%, meaning if you are not blue in this diagram, it is more likely than not that any person you run across is unvaccinated. That means if you are carrying the virus, it is more likely than not that any person you run across can get severely ill if they get it from you. Going over 40% now, though: Graves, Henderson, LaRue, Bracken, Boyd, and Knott. And what this tells me is we got a lot of healthcare professionals out there still hustling, still working really hard. And to them, I would say keep it up. To others, I would say please get vaccinated. And as we look at the vaccination status of hospitalization and deaths, again, this is holding pretty steady. This, I believe, has been updated. It still says August 31st. We'll check on that, but it's still that cases have been at 90% for the past several weeks. Hospitalizations, the same, and deaths, we hope, and we pray that the boosters are going to have a big impact on this. What we think is that those that in breakthrough cases are getting really sick, are ending up in the hospital, or passing away, are folks that were at risk in the beginning and ought to be qualified to go ahead and get the booster shot now, immunocompromised and others. So the first time in a while, we have a memorial today. And this is somebody I've known better than just about anybody else that I know that we've lost to COVID. You know, early on, it was Lillian Press, an amazing person, an amazing Kentuckian. And this one is another amazing Kentuckian we've lost. So COVID continues to take family members, friends, and loved ones far too soon. Today we remember a great jurist, a great public servant, a great friend who worked to benefit the Commonwealth over many decades of service. Judge Tommy Wayne Chandler, who served as circuit judge for the 5th Judicial Circuit, died last week on September 2nd of complications after becoming ill with COVID-19. Judge Chandler was born in Dixon and grew up singing in gospel quartets. He was a veteran, serving in the Army National Guard Armory in Providence, Kentucky in the early 1960s. He excelled in academics. Judge Chandler attended Evansville College and Murray State University before graduating #1. That's something I certainly wasn't able to do in his class in law school from the UK College of Law in 1965. Judge Chandler returned to Webster County. My goodness, he loved Webster County, where he began his long career as a public servant. And he did everything. He was Providence City Attorney. He was Webster County Attorney. He was Assistant Commonwealth Attorney. He was Commonwealth Attorney. He was a member of the Webster County Board of Education for 25 years. And as a circuit judge, he distinguished himself. My goodness, you would hear decades after about what a great judge that he was, how fair and thoughtful, and that just about every time he got it right. In retirement, Judge Chandler continued to work on behalf of the Commonwealth and our people, including at the State Personnel Board, a post that both I and my father appointed him to, and in which he excelled. From the hospital, he asked a call to be made to the board, worrying about missing a meeting. Judge Chandler represents the best of Kentucky. His loss is a personal tragedy to his family and friends and to mine. I would not be governor but for his efforts and kindness. And I'm thankful that over the summer, when we had the opportunity to be out a little bit more, and we announced a new community college setting from what used to be a coal headquarters, I got to see him and his wife, Benita, as well as a little more recently here in Frankfort. Those would be the two last times I had an opportunity to talk to Tommy. When we turn on our green lights this evening and ring bells to acknowledge the losses we've suffered in this pandemic, I invite all Kentuckians to share a little moment, a prayer for Judge Chandler, his wife Benita, his three daughters, Lucia, Karen, and Carla, his grandsons Kent. Kent worked for me in the Attorney General's office. Incredibly talented. He's a friend. He is chairman of the Public Service Commission here in Kentucky, along with grandson Benjamin and other beloved family members. Let's recommit to doing everything we can to stop this deadly virus. Let's also be really careful with other folks in our community. If you refuse to wear a mask, please don't go around folks that are trying to do it right. I mean, Judge Chandler was one of the kindest individuals you would ever meet, generous. He deserves to still be here, and his family doesn't deserve to go through this. We love y'all. We are with you. We are so sorry about this loss, and I hope that we can all commit to doing better moving forward. And one other piece of tough news. Today, we let those in Nicholas County know that FEMA has denied the request for individual assistance for those harmed by the flooding. We are appealing that denial right now in hopes of ultimately persuading them to provide help to folks that were harmed in severe storms between July 29th and July 30th. That makes the part of this special session that would extend the state of emergency that much more important to look at other options that we might want to consider for how to help those that were harmed. The appeal letter will be sent to the president, to FEMA, and we hope will get everybody's attention. The appeal must be submitted within 30 days of the denial letter, which was September the 5th. We believe that the reasons it was denied is that this disaster was more localized than just about any we've ever seen, not just to a small town, but almost to a small part of a small town, but right downtown in an area where people want to get back in their homes, except their homes were picked up off the foundation and dumped in front of it. I mean, red X's painted on it because they could not be re-entered. It was traumatic for each and every one of those families, and the denial's not going to help how they feel today. I want them to know that we're going to push, we're going to appeal. The extension of this state of emergency will hopefully give us additional options that we can consider with the legislature. So with that, we'll open it up to journalists. I know we'll probably have some questions on the session. It is moving along. We have had a lot of conversations over the weekend with leadership from both the majority and the minority in both chambers. We've been able to comment on drafts of bills. There were even changes made to many of the drafts before they were filed. It's been a very positive working relationship where on about 95% of things, I think we are in agreement. Obviously, there is disagreement over masking. I think that that'll be a real debate as we move forward, but the willingness to listen and the communication back and forth has been very positive, and we as administration certainly greatly appreciate it. And that's all the way from the top leadership levels all the way down through the staff. So with that, we'll start with the folks that are here in person. Wouldn't be a press conference without Tom Latek.
Thank you, Governor. Speaking of the session, you may have noticed or seen right before you got down here, the House did pass House Joint Resolution 1, and that's the one involving all the executive orders. What are your thoughts specifically on what they did and what they may have left off?
So what has been passed thus far is kind of a big checklist of executive orders and administrative orders that have been put out on different ways to fight the pandemic. We've put these out over time, beginning March 6th last year. There are things like people being able to get prescriptions refilled without having to put themselves in danger, workers' compensation for our frontline workers, recognizing doctors and nurses from other states, price gouging. We went through this list with them, and folks were very receptive. There are some pieces on unemployment and presumption that won't continue, but I think about 95% of the belt and suspenders, if you will, were in there and was passed. And I think it shows that the House is serious about doing the work. That bill was very collaborative in how it went through. Chad.
I've heard from several teachers today who are very concerned that the KBE mask mandate is going to be repealed. Your thoughts of if this action does go through? I know that this is something that is being efforted, and it seems teachers very concerned about it.
Well, I think universal masking is absolutely necessary if we want our kids in school. It's very clear across the country, if you do universal masking, you can keep kids in school most of the time. It's still a challenge, but it gives you the best option. If you don't, nobody's able to stay in school. Whole towns end up getting shut down. But it's not me. We got a couple of they are the experts. The CDC talks very clearly, and remember House Bill 1 that was passed, it's one of the reasons we're here in a special session, said the CDC are the experts. And so they've said very clearly that because of the Delta variant, CDC recommends universal masking indoors by all students 2 and up, staff and teachers and visitors to K through 12 schools, regardless of vaccination status. So if we don't continue universal masking, we need to know we are ignoring or disagreeing with the CDC and claiming we know better. The CDC, just like all of us, is still always learning about a virus that mutates, but they are the best and the smartest and the most recognized when it comes to this. The next, though, would be the American Academy of Pediatrics. Remember, this group even broke a little earlier and said we got to get kids back in school, but they wanted to do it safely. So they recommend face masks, including staff and educators who are fully vaccinated, especially for teachers with students who are unvaccinated. These are the 2 primary groups when it comes to kids. So if kids want to stay in, we got to keep them from getting COVID, right? And masks absolutely slow the spread. That is fact. But here's the other thing. When we don't require masking in schools, we put the staff, the faculty, at more risk. So it's not just, a superintendent or others making a decision for parents. What about that teacher? Think about a classroom that is unvaccinated. If they're not wearing masks, the exposure grows and grows and grows and grows and grows and grows for that teacher or that custodian or the other. They are better protected if there's masking. And what we've seen in breakthrough cases is the more exposure you have, the more chances it has to break through. And so in an unmasked scenario, those we're asking to go in and actually teach are at more at risk even if they are vaccinated. So this is for the safety and health of the kids. It's to keep them in school. It's also for the safety and health of the teachers themselves. But let's look at it from another angle. We have already seen when we have schools shut down because of COVID, we have people who can't go into work. That's why the Kentucky Chamber of Commerce came out for universal masking, because they know how much it hits our workforce. So you can come at it from a number of different angles, but it's really important. And if the legislature won't give KDE the authority to do it, or me the authority to do it, what about setting a metric? Like if you're in a red county and all of a sudden you take off masks, oh my goodness, right? I mean, you're in the thick of it. You're in what is crisis mode, and suddenly we would take a tool away that is there. So surely we should at least be able to get to a point where orange or red, they can either say masking at that point is required, or they can give authority to myself. They can give authority to the commissioner. But I mean, being in a red county and going in unmasked, I mean, it just won't work. Covington Catholic, and by the way, they didn't sue me. Some parents did. They were actually going along with what we did. Attempted to do mask optional and now had to go to mask mandatory. And I think they tell you they did their best. They tried to use all the different other tools that are out there, but Delta's too strong. And if they want their kids in school, which they did, they made the tough decision, even with some parents being upset, to require masking. Melissa Patrick.
So it looks like they're working to get a monoclonal antibody clinic in each of the 15 ADDs.
Mhm.
And so I'm curious if you support that, and if you feel like this is something you had even considered along the way. And also, when I talk to people, there are many Kentuckians who still have no idea what those are,
Right.
and that they're there. So anything to do about that?
Monoclonal antibodies are one of the best treatments, especially early on if you have COVID and you're starting to get really sick. That can give you the very best shot of getting through it. It is an infusion. And so it's a pretty significant thing that takes trained personnel to do it. I mean, chemotherapy is an infusion. And in many ways, the same staff can be very similar. Right now, and looking at where monoclonal antibodies are being ordered, number one, they're being ordered more week over week over week over week. And they're being ordered in every area development district right now. So I want to be very clear that we support monoclonal antibody treatment, and we are working with providers and with the federal government to increase it everywhere. Now, there is a little bit of a nuance here. Some versions say establish a monoclonal antibody center, and others say support and work with existing providers and other providers, right, to increase treatment. I worry about this whole establishment concept in that it would be state government creating this medical clinic that would do what to staff it. We'd have to hire staff away from hospitals or centers already doing this at a time when 60 out of 95 hospitals are already at critical shortages. So we agree with the intent. We want to make it happen. I think the language of the House bill is something we absolutely support at the moment. We just want to make sure we're doing it in a way that doesn't have the state trying to hire personnel away from other places. But we think we can run with the intent of this, and we're already doing it to make sure that this treatment is more readily available all across the Commonwealth. We've had really good discussions there. Everybody has been very open about wanting to make it work. WLKY. Yeah.
So early in the pandemic, Kentucky was often highlighted as states that were doing things right, and it seems the opposite has been the case now, and a lot of that has to do with tools that have been taken out of your toolbox. Are you confident that in these special sessions, just based on early talks, that at least some of those crucial tools will make it back in, and you might get back a little bit closer to the beginning of the pandemic?
So I believe, even with the Delta variant and where we are right now, that Kentucky's journey has been a success story, but against what? Against a very deadly, dangerous virus. Even after what we're going through, I don't think that we will be anywhere close to the devastation that we have seen in so many other states. And remember, states are getting hit at different times. We got states to our north that are going to be a couple weeks or a month behind us that are going to go through what we're going through, even with the higher vaccination rates. Our challenges are every other time that we've had a surge, we've been able to use masking. We've been able to require it not just in schools, but in indoors when you're outside of the home. Without that, we are not going to do as well this time because aside from vaccination, masking is the most effective tool, and it's worked 3 times against 3 surges. So that will be an essential tool for how well we can do this surge versus others. All the other ones are important too. The other ones are about healthcare capacity. Without those tools, more people die because they can't get treatment. So I believe if we get every tool up to masking, we will save a lot more people. I believe to be as effective as we have in the past, we need masking too. Now, I know that that's going to be a big debate, and ultimately that's going to be decided by the legislature. I will do my best with whichever tools we have, but I think any healthcare professional would say when people mask, you reduce the spread of the virus. Let's see. On virtually, we have Corinne Boyer from WEKU.
Hi, Governor. With only 2 pediatric ICUs in Kentucky and more children being hospitalized, how full are those pediatric ICUs right now? And will those stats be included in COVID-19 reports? And then by the end of the year, realistically, how much of the state's population do you expect to be vaccinated?
Let me work on a projection on by the end of the year. I look day to day, hoping about how many people have been vaccinated. I can't say I've looked at a projection if it holds, if it grows, but let us do that. As far as pediatric ICUs, there are 2 in the state, and this is bounced up and down. I think we have what we know of 4 children currently confirmed in the ICU. That means they're in one of those 2, though. What we don't have a count of is how many children are in an ICU at a hospital that's not pediatric, but when they go in, needs to be stabilized by it. So I believe we have 2 children on ventilators right now, 4 total in the ICU, and that bounces up and down. Let's see, at the end of last week, we had 7. So remember, sometimes this can also be reporting, and when it's coming in. At the end of last week, we had 6 in Louisville, 1 at UK, 4 on a ventilator. Now, we never know when someone comes off a ventilator if it's a good outcome or a bad outcome. Karen Czar from WKY.
Good afternoon. Thank you, Governor, and thank you, Rachel. Governor, some states are reporting a lack of J&J vaccines because shipments from the company have slowed or stopped. Are we seeing anything similar here in Kentucky? And if so, what is your message to anyone who's adamant about getting one brand over the other? Thank you.
So we haven't seen a high level of demand for J&J versus any other vaccine. Certainly, if there is somebody that finally agrees to get vaccinated and J&J is the only one they'll take, I want to find them one of those vaccines. We see primarily Moderna and Pfizer, actually a whole lot of Pfizer, recently being the primary. Right now, I think there's more research out on them. The future on their booster is probably a little more clear. Even if the FDA and the White House are on different timetables for it, which I think is understandable because the FDA normally makes the decision and then you can start implementing it the day after, which is always our challenge if we learn about it just on that day. But I believe that there will be a J&J booster. I believe they're working on it right now. So our real plans on J&J would be to make sure we are ready to get that booster to anyone who took that vaccine. But certainly anyone out there, if that's the only vaccine that they are willing to take, we want to find it for them. Sarah Ladd, Courier Journal.
Yeah, thank you. You may have seen the New York Times report this morning about how breakthrough cases may account for 1 in 5,000 cases, or in the right situations. In some situations, it might be 1 in 10,000. Do we have an updated number on how many breakthrough cases we've seen in Kentucky and what kind of ratio we're seeing here? Thanks.
Let us get that. Let's put up the vaccination chart that goes through August. No, the chart, not the graph. There we go. So this would be March 1st through August 31st. Looking at 15,000 fully vaccinated cases versus 148,000, 149,000. So it's about 10% of our cases. Now, typically, the CDC is tracking breakthrough cases as typically requiring hospitalization, not just positive cases. And I think what we're going to find out, I mean, I believe it, and what we're going to find out is there are a lot more positives among vaccinated individuals. It's just they're not symptomatic. That the vaccine against the Delta variant does such a good job that you might not know you have it. I know 2 individuals that were asymptomatic that tested positive very recently. I know a lot more than that. So I think that if you are fully vaccinated like I am, number one, you need to get tested regularly. And number two, we got to recognize that it is, you are more than 5 and however many thousand, you mentioned likely, to get it and test positive if you're not careful, and then to spread it to others. So I get these statistics in that you want to show people how good it is to be vaccinated, and it is great to be vaccinated. And you just look at our hospital numbers to see that. But what I worry is it gives people who are vaccinated false confidence to not wear masks, thinking they might not be positive and might not be spreading it. So if that makes sense, it's a tough line, right? Because you want to show people how effective they are in preventing you from getting really sick, but you don't want that false sense that you're not spreading it. Because when we find breakthrough cases that are positives, you then find it's run through people's families too. Originally, and even in Alpha, somebody in your family would come down with it, right? And nobody else would have it. And so you'd isolate that person. Now with Delta, we're finding just about everybody in a household has it when there's a positive. Allie Hennard from WBKO. I think she dropped off. Well, for the folks that are here, we were working to finish up fast. Any follow-up? Nope. All right. Thank you all very much. Oh, I think we had one. Nope. That's it. Thank you all.